Hey guys, today we're going to talk about ACL injuries in female athletes and why do we see so many females getting these ACL injuries so often and what can we do about it? So we need to understand that since the 1990s, conversations involving female athletes have sounded a bit like females are predisposed to experiencing these injuries because of their anatomy, because of their hormones, their muscle imbalances, and poor neuromuscular function. But it's really important for us as coaches who work with female athletes to understand that once we previously thought as fact is actually not as cut and dry as we had once presumed. So what do we actually know? Well, females are 2 to 6 times more likely to experience an ACL injury compared to male athletes. And in the adolescent population, we can see an upwards of 10 times as likely. We also know that 80% of all ACL injuries are non-contact and therefore overuse injuries. We know that these injuries are typically experienced during deceleration, lateral pivoting, or landing tasks. We know that high knee loading tasks in sport occur at very similar levels between both genders. And we know that females that are around 15 to 20 years old account for the largest number of ACL injuries reported. Okay, so what are the differences between male and females? Well, we can talk about anatomy, and that brings into conversation Q angles, notch sizes, and our propensity for valgus. It also brings to conversation hormones and how our hormones fluctuate and affect ligament laxity and how this fluctuation may affect our injury rates during menses. And then we can also talk about a possible difference in neuromuscular function and the relationship of this function to hormones, muscle mass, and how it changes during the adolescent growth period. So today we're going to keep our conversation primarily focused on the most talked about difference in females in literature, and that is our anatomy. So how did this conversation even get started? Well, after Title IX, more females started to participate in competitive sport. Obviously, with more females becoming competitive, we're going to see more injuries because sport is going to increase the chances of injuries of any athlete. However, when we look at the female athlete population, we see that there is a drastically higher incidence of ACL injuries to such an extent that in the 1990s, we considered this higher incidence an epidemic. And this is an epidemic that is still occurring and it's almost 2020. So why? Well, research has also consistently reported larger knee valgus motions in women compared to men, performing side step cutting movements as well as jump landing tasks. Okay, so is anatomy the reason that women are experiencing or demonstrating more valgus than a man? And is valgus this abhorrent movement pattern that we must fear our athletes out of? Well, let's talk about what actually dynamic knee valgus is. So dynamic knee valgus can be defined as the relative internal rotation of the lower extremity against a relatively fixed foot or pelvis. Think of this just as displacement or movement from the midline. But is dynamic valgus inherently bad? Well, let's understand why humans move. And that reaction movements are just the body's reaction to the load placed upon it. So think of a movement like a jump or a quick stop. And during this moment, a female is exposed to load. Think of her body weight times gravity times her velocity of movement. And as this load is exposed to her body is going to react as a means to absorb this load through her tissues like her muscles, her tendons, her ligaments, and her bones. So what is an efficient movement pattern? Well, how are we defining efficient? So if we think about knee stability or a decreased movement of the knee as a more efficient movement pattern, this is because limited movement at that joint is going to demonstrate that more load is being absorbed by our tissues, such as our muscles that are more equipped to handle load versus other tissues such as our tendons and ligaments that are not quite as equipped. So for the knee, in a landing, cut, or deceleration, good stability is going to result from a co-contraction of our hammies, quads, glutes, and maybe some calves. But we want this, right? We want this co-contraction to be perfect. But here's the thing. We're talking about humans here, and humans are not perfect, nor are we balanced, and nor are our playing conditions. So even the best athletes in the world do not move with the best technique or biomechanical efficiency, especially when they're fatigued. So when this co-contraction isn't perfect, we're going to see that there's more freedom of movement at the joint, resulting in a decreased stability. This means less efficient movement patterns, such as valgus, can occur. Now, this is when it can be hard to separate the bad reputation of valgus and its place in the real world. So although valgus is not the most biomechanically efficient movement when we are considering the amount of load exposed to the ACL ligament, it's not a movement that's inherently bad, because we're talking about athletes here, and athletes are meant to move in multiple directions and at multiple velocities. So, and we have to understand the efficiency of movement patterns is going to depend on many factors, such as an athlete's strength, her neuromuscular coordination, her body awareness, and years of motor skill acquisition. All of these are going to play a role to how a body responds when force is applied on it. So rather than villainizing this movement pattern, we need to take a step back and try to understand, okay, why are females demonstrating this movement pattern more so than men? And is this related to why females are experiencing more ACL injuries? Well, is it because of our Q angles? So what actually even is a Q angle? So a Q angle was first described in 1964 as the angle formed by the intersection of two lines, one that goes from the hip to the center of the patella and one from the tibia up to the center of the patella. So clinicians previously used the Q angle as a means to evaluate patients that were experiencing knee pain. So theoretically, it was believed that an excessive Q angle may favor excessive dynamic knee valgus. And in fact, most clinicians, especially in the early 90s, believe that us ladies experience more ACL tears because we had wider hips and therefore larger Q angles. But we have to remember this was just a theory. And new research that we come upon is going to affect the validity of this theory. So what is the research? Well, as researchers have delved into this theory, we have discovered that not all females actually have wider Q angles compared to male athletes. In fact, there may only be a mean 2 to 3 degree difference between the sexes. Okay, so it's also very important for us to understand that men and women of equal height actually demonstrated similar Q angles, showing that this relationship between Q angles may more so be related to height than it is to actual gender. Okay, so it's also very important to understand that there is no clear link between ACL injuries and Q angles, nor is there an actual consensus as to how we actually measure these Q angles. But outside of that, let's think about that female that lays outside of that average spectrum, and maybe she does in fact have very large hips and a wide, large Q angle. Guess what? There's not much evidence that supports the relationship between Q angles and this knee valgus that we keep seeing more females demonstrate. In fact, very interestingly, a study in 2005 demonstrated that individuals classified as having larger Q angles did not present greater knee valgus, but instead we saw the opposite, that athletes that had smaller Q angles demonstrated more knee valgus. Okay, so with the lack of evidence here, it's pretty obvious that Q angles don't really seem to be the culprit in why females are experiencing ACL injuries at this higher rate. And why are we demonstrating more moments of knee valgus? Okay, so not the Q angles. What about the notch? So the femoral intercondylar notch is going to be the area at the base of the femur where your ACL inserts. And it's hypothesized that smaller femoral intercondylar notches may imply a smaller ACL. And that means that a smaller ACL can't handle as much load as a larger one. So this implies that, okay, females have smaller notches, we have smaller ACLs. Over time, we're playing these high load competitive sports compared to males with larger ACLs, and we just don't have the capacity to handle as much load as them. So that's why we keep tearing our ACLs. Well, here's the thing. There's no conclusive evidence that there's a relationship between ACL and notch size and gender. Rather, we see that there is more of a relationship between these notch sizes and, again, height, kind of like our Q angle theory. So yeah, some females may have smaller ACLs compared to males, and therefore they may have a smaller capacity to handle load, but it can go the other way as well. So it's really important to understand here that there is no conclusive evidence that this ACL and notch size relationship has anything to do with gender. Again, on the contrary, remember, this notch size may be more related to height. Okay, but yeah, some females on general on the spectrum are smaller in stature compared to males. But we're not only seeing small females experiencing these ACL tears, because if that were the case, when we see just small athletes in general experiencing these injuries, and that's not the thing. So if anatomy is not the cause, how can we then explain why are females experiencing ACL injuries more than men? And again, why are females demonstrating more instances of this knee valgus? Well, this kind of all has to come down to that adolescence period. So when we think about the fact that most ACL injuries that occur in female athletes are going to occur between the ages of 15 and 19, this is during puberty. So what's occurring? So previously, researchers hypothesized that, okay, during puberty, it could be hormones, we'll talk about that later, but our hips are getting wider, and therefore that is, we don't know how to move our body now with these huge wide hips. So this is why we are demonstrating more instances of knee valgus and experiencing these ACL injuries. But remember that there actually isn't a definitive link between knee valgus and Q angles or notch size. So what's actually going on here? What else is changing during puberty? Hormones, again, another discussion, and our muscle mass and neuromuscular coordination. And this is important because muscular strength and neuromuscular control are crucial components of knee stability during the execution of sport movements, as you see here. Okay, so now this brings into discussion what's going on during puberty, and males and females are going to grow differently. So during puberty, males experience what is known as both a growth and neuromuscular spurt. So males that go through puberty, they're going to have an acute rise in testosterone. So what happens, remember, testosterone is anabolic, so we're going to see an increase in the skeletal size of the male, as well as a concurrent increase in the amount of muscle mass. From a very pure physiological standpoint, let's think if ACL injuries or overuse injuries, more muscle means a greater capacity to handle load. Females don't have this acute rise in testosterone, and therefore we don't see this neuromuscular spurt. Therefore, meaning that we're having a growth in our skeleton without this concurrent growth in our muscle mass. Therefore, we have a lesser ability to dissipate forces when they are applied to us. Okay, so does this mean that females will always be at a higher risk of ACL injuries just because from that acute growth point? Well, this brings us back to the first idea that maybe valgus isn't the actual, this is the thing to fear. Maybe valgus is a signal of what is going on during this adolescent growth period. So we mentioned that 80% of ACL injuries are non-contact and therefore are overuse injuries. And it really boils down to this. We're exposing our athletes to more stress than they have the capacity to handle. And so when our muscles can't absorb that load, the load has to go somewhere, so it goes to tissues that are less equipped, such as our ligaments, like our ACL. And that valgus movement that that athlete made during her soccer game, that was the straw that broke the camel's back. Is it the straw's fault? We're gonna say no. And instead of blaming that pop or the tear on the straw, it's really important to understand, okay, is it the valgus, or maybe it is more so related to just overall the athlete's ability to handle load. And this is going to help us turn to, okay, so what is working when it comes to reducing these chances of injury? And this brings into conversation neuromuscular training modalities, and that neuromuscular training modalities can reduce the chance of ACL injuries by about 50% in female athletes. So something here is working. But unfortunately, this training can encompass many different modalities, such as strength training, plyometrics, balance, and stretching. So in a review of these training modalities, the most effective programs seem to include these three things: lower body strength, landing stabilization exercises, and the program was provided by a coach or an instructor. Meanwhile, the programs that included balance or core strengthening or stretching or agility had actually no benefit to the program. So this means that improving your athlete's balance on a BOSU ball is not really an efficient use of her time. Okay, so what is an efficient use of her time? Well, clearly strength training, because strength training is going to help females develop lean tissue and strength. Remember, non-contact ACL, overuse injuries. So larger amounts of lean tissue mean the athlete is going to have a better ability to dissipate forces when they are imposed upon her. And that's just purely physiological, right? So larger proportion of lean tissue, both muscle and ligamentous, because our ligaments are going to also respond to strength training or really any type of loading task. This means that ligament has a higher point of failure. Okay, so what about the fact that beyond physiology in itself, when you have stronger muscles, your body is more adept at recruiting them for movements, such as landing or from a jump or decelerating from a cup. Okay, so we know that strength training works, but what about this like muscle imbalance thing? So yeah, we have found in studies that females who strengthen their hamstrings in relation to their quads have a much improved knee tracking and landing and deceleration movements, leading to a decreased amount of force imposed on the ACL. Okay, so are all females quad dominant? Well, I think that also brings us back to, do all females have larger Q angles? It's going to be a spectrum, right? And not all females have larger Q angles, and not all females are quad or hamstring dominant. And instead of looking at these very particular things, we need to take a step back and again, think about female athletes in terms of if they're experiencing more overuse injuries, why? And why are they demonstrating this knee valgus? And is knee valgus really the cause here, or is it telling us that females are not moving with this efficiency because they are lacking the not only strength or lean tissue, but also just the overall neuromuscular coordination of how to move with this efficiency? And movement is a skill, and this motor skill can be really acquired in two main ways. Okay, so we can look at learning from landing of a jump as a motor skill that can be learned either explicitly or implicitly. So let's think of your female athlete and she is doing a jump landing task. Like we said, in those neuromuscular training modalities that seem to be productive is that, we're having her, she's in her drill, she's jumping off of the box, and we're cueing, your coach is cueing her, bend your knees, drive your knees out, don't let them come in. So every time she performs this drill, she is thinking knees out, knees out, knees out, right? So as she performs this skill and is practicing and acquiring this motor skill and landing, she is explicitly learning how to land. Okay, so what about implicit learning? Oops, good. So, sorry. Cool. Okay, so what about implicit learning? So let's imagine an athlete that is a female athlete that's doing her strength training program, and she has a bar overhead, and we have to teach her how to lower it to her shoulders. As she lowers the bar to her shoulders, your coach is cueing her, absorb the bar with her body. Okay, so this movement is a movement that actually is mimicking landing from a jump, and the athlete, as she lowers the bar, must figure out a way to absorb the load. So could her knees fail and come in and demonstrate valgus? Yep. Could they remain stiff? Yep. But as she practices this drill and she improves her body awareness and her strength, her body is eventually going to find a better or biomechanically safer position in that she's going to bend her knees so that way she can bring more weight down, and she's going to absorb that bar in her shoulders. So now she is learning this motor skill, but she's learning it implicitly because she's not focusing on avoiding valgus. And this is really important because how you learn matters. So research demonstrates that motor skills that are acquired explicitly, remember, like practicing that movement, they tend to be less resilient under physiological and psychological fatigue. So basically, if you're only doing an action in this drill because your coach told you to focus on it, kind of goes out the window when these athletes are fatigued. Versus if you implicitly train your body to move, you're much more likely to repeat that movement unconsciously. So plyometric or jump mechanic training can show some early successes in reducing ACL injuries, but they also have been shown to fail to sustain those results long term. And researchers have theorized that these results could be linked to the type of explicit motor learning strategies. So regardless of the strategy, what is the most important thing that we have to understand here is that consistency is key. And in all of these programs that we have looked at that implement these various types of neuromuscular training modalities, athletes that did not sustain 90 to 100% adherence to the program did not show a statistically significant decrease in ACL injury risk. This is regardless if they were doing strength training, balance, core strength, landing mechanics. So doing nothing clearly is not an option, especially for these females that clearly have a high disposition to experiencing these ACL injuries. Okay, so the biggest problem here is actually that most females are not engaging in any type of prevention strategies habitually. Keyword, habitually. In fact, the use of ACL injury prevention programs by high school teens is very low nationally. It's only 30 to 20%, and very low in rural areas, around 4%. And even more so if we actually just look at strength training and their requirements. Even though there are very meager studies at this female athlete population, we are seeing that only 8 to 10% of female athletes are required to strength train, which doesn't make sense in that ACL injuries are overuse injuries, and that overuse injuries have been shown to be reduced by the superior dose-dependent training modality called strength training. So are female athletes experiencing these ACL injuries because of their anatomy? Well, we know it's not their Q angles, and we know it's not their notch sizes, but we do see that more females are experiencing these injuries during adolescent growth. What's the difference between male and females? Hormones, that's a conversation for later, as well as the relationship of those hormones and of just that growth period and the difference in skeletal and muscular growth. So we need more females to understand, as well as their coaches, as well as their parents, that training is necessary because they are athletes. And females are, perhaps genetically, have a higher disposition. Again, we'll talk about that next time. Or maybe we have this higher disposition because we are not being exposed to the one training modality that we know is going to decrease their chances of injuries. So maybe it is this lack of requirement. Maybe it's a lack of understanding. Maybe these sport coaches need to understand that playing your sport is not enough to prepare the female body for the stressors of their sports. Whatever the reason, it's very obvious that if females are not habitually training to prevent these injuries, they're not going to reduce their chances of this injury that they have a very high risk of getting, period. So is it their Q angles? Nope. Is it their notch sizes? Nope. Could it be their hormones? We'll talk about that. But what we do know is that 80% of these injuries are overuse injuries. And what do we know we can do to help reduce the chance of these overuse injuries from occurring? It's strength training.